Hello everyone, welcome back to RPIIT Academics. In this video, we are going to learn about spatial stain. So basically, spatial stains are used to identify certain normal and abnormal substances present in the cells and tissues, which cannot be identified on routine hematoxylin and eosin stain, or are better appreciated on spatial stains. Now there is a classification regarding spatial stains. We have 5 type of stains. First one, connective tissue stain, carbohydrate stain, pigment stain, that is a mineral stain, amyloid stain, and microorganism stain. If we talk about connective tissue stain, we have 2 type of stains: Manson trichome technique, reticulant staining technique. So first stain is Manson trichome technique. So Manson trichome technique is used to differentiate between collagen fibers. The collagen fibers will be stained in a blue color and smooth muscles will be stained in a bright red stain. Trichrome is named because 3 dyes are used, which may or may not include nuclear stain. The principle of Manson trichome technique is that the general rule of trichrome stain is that a smaller molecules of dye penetrate and stain its tissue element. However, the large molecule penetrate the same element and the smaller molecule will replace it by larger molecule. So, smaller dye molecule stains as RBC, that is a red blood cell, muscles, collagen, and medium dye molecule stains muscles and collagen. Larger dye molecules will be stained collagen, and preferable fixatives are used in this stain, that are Boyne's fluid and Jenker fluid. If we talk about reagents of Manson trichome stain, that would be acid fusion, 0.5 gram acid fusion, and 0.5 glacial acetic acid will combine to each other and make acid fusion in 100 ml of distilled water. Then we need a phosphomolybdic acid. In phosphomolybdic acid, we have a 1 gram phosphomolybdic acid in 100 ml of distilled water. Then we have a methyl blue. In methyl blue, we have 2 gram of methyl blue and 2.5 ml glacial acetic acid, which will be saturated in 100 ml of distilled water. Now, if we talk about the procedure of Manson trichome stain, firstly, we have to deparaffinize sections and take to water. How we can deparaffinize the section? We have to put the slides into incubator for 15 minutes so that the paraffin wax over the smear would be melt down, and then we have to take the smear in xylene 1 for 15 minutes and in xylene 2 for 5 minutes. That's how you can do the deparaffinization of the section. Then you have to remove mercury pigment, cover the Lugol's iodine, and then decolorize with 5% sodium thiosulfate. Then we have to wash in tap water, and then we have to stain the nuclei by Celestine blue Mayer's hematoxylin for 3 to 5 minutes. This stain would be primary stain in this Manson trichome method. After that, we have to differentiate the slide with the help of 1% acid alcohol. Then we have to wash well and bluing in running tap water for 5 minutes. Stain in acid fusion solution A for 5 minutes. Then we have to rinse in distilled water. Then treat with phosphomolybdic acid solution B for 5 minutes and drain it. Then we have to stain with methyl blue solution C for 2 to 5 minutes and rinse in distilled water. Treat with 1% acetic acid for 2 minutes and dehydrate through ascending grades of alcohol. Then we have to clear the smear in xylene and mount in permanent mounting media, that would be DPX. The full form of DPX is distyrene polystyrene xylene. So this would be the result for the mentioned trichome stain. So the nuclei blue will look as a black in color. Cytoplasm, muscle and erythrocyte will be look in a red in color, and collagen will be look in a blue in color. So that was it for this video. If you like this video, then please do subscribe our channel. Thank you very much.